Are you one of the millions of people over 50 years taking medication for either bladder control, anxiety, or depression? If you are, then your brain is at risk, and this video could potentially save your memory. In this video, we'll show you which and how some common pills are hurting your brain without you knowing it. Don't worry though. We'll also give you tips on talking to your doctor about safer options, so you can make better choices about your medications. Did you know that some of the most common medications might be shockingly putting your brain health at risk? At some point, omeprazole is one of these medicines. But first, for those who don't know, there are a class of drugs called anticholinergics, and chances are, you or someone you know is taking them right now. These medications are widely and commonly prescribed for conditions like allergies, depression, and bladder control issues, especially among people over 50 years. But here is the shocking truth. There is an absolute troubling link between these anticholinergic drugs and an increased risk of dementia. A study found that people who used these medications had a 46% to 54% higher chance of developing dementia compared to those who didn't. That's a significant increase that we simply cannot ignore. So, how do these medications really affect your brain? Keep watching to learn which and how these medications could really end your life before dementia does. If you are not already a subscriber of my channel, please go ahead and subscribe to my channel and share this video to whom might benefit best. As we age, our bodies become less efficient at processing medications. Our kidneys and liver, which are responsible for clearing drugs from our system, don't work as well as they used to due to organ degradation. So this means that some drugs can build up in the body of older adults, leading to higher drug levels in the blood and more prolonged effects. This accumulation can increase the risk of side effects and cognitive impairment. Additionally, it all comes down to a crucial neurotransmitter called acetylcholine. For those who don't know, acetylcholine is a chemical that carries messages from your brain to your body through nerve cells. It plays a vital role in memory, learning, and attention. So what anticholinergic drugs do is, they work by blocking the action of acetylcholine in your body. While this might be helpful with certain symptoms, it is also directly impacting your cognitive function negatively without you realizing it. Let me break this down. Picture your brain as a complex network of connections, with acetylcholine acting as the messenger that keeps everything running smoothly. When you take these anticholinergic medications, they interfere with the entire process, so it's like you are realistically putting up roadblocks in your neural pathways. And over time, this interference could contribute more to cognitive decline and potentially increase your risk of dementia. As we've said earlier, omeprazole is really one of those medications, but I know you might be wondering, which other specific medications we're talking about? While there are several types of anticholinergic drugs, one category stands out as particularly concerning, which are the bladder control medications. Quite popular drugs like ditropan, also known as oxybutynin, and Detrol fall into this group. So these medications are commonly prescribed to manage overactive bladder, which is a condition that affects many older adults. Many people have been taking them for years without realizing the potential long-term effects on their brain health. It's a hidden danger lurking in medicine cabinets across the country. Now let's move on to some of the anxiety medications you've been using. Can you choose between anxiety and cognitive health? At 60 years old, it sounds very impossible, right? But you have to know that this isn't just a hypothetical scenario, it's a daily reality with far-reaching consequences. Valium, Ativan, and Xanax are some of the most commonly prescribed medications for anxiety and insomnia, especially among older adults. These drugs work on the central nervous system and are called benzodiazepines. Of course, these drugs can undoubtedly provide quick relief from symptoms of anxiety, helping people feel calmer and more relaxed. But this short-term benefit comes at a potentially steep cost to your long-term brain health. Recent research has uncovered a troubling link between benzodiazepine use and an increased risk of dementia. One study found that people who used these medications for more than 6 months had an 84% higher risk of developing Alzheimer's disease compared to those who had never taken them. That's a significant increase that raises serious questions about the long-term use of these medications. So how do benzodiazepines affect your brain? These medications work by enhancing the action of a neurotransmitter called gamma-aminobutyric acid, or GABA for short. For those who don't know, gamma-aminobutyric acid is a brain-calming chemical which can help reduce anxiety and promote sleep. But while this slowing effect can provide temporary relief, it can also lead to cognitive impairment, confusion, and slower reaction times, especially in older adults. Another significant concern with benzodiazepine use in older adults is the increased risk of falls. The sedative effects of these medications can impair balance and coordination, making accidents more likely. Given that falls are a leading cause of injury in older adults, this added risk is particularly worrying. But don't lose hope. There are safer alternatives for managing anxiety that don't come with these cognitive risks. Many experts now recommend non-drug approaches as the first line of treatment for anxiety in older adults. Cognitive behavioral therapy, CBT, for example, has been shown to be highly effective in managing anxiety symptoms. This type of therapy helps you identify and change thought patterns that lead to anxious feelings. Relaxing exercises, such as meditation and deep breathing exercises, can also provide significant relief from anxiety without the risks associated with benzodiazepines. These techniques help you stay present in the moment and reduce worry about the future, which is often at the root of anxiety. So if these drugs are so risky as I've said, then why are they still being prescribed? That's an excellent question, and it's one I think we should explore in depth. We'll look at the reasons these medications remain popular despite the known risks, and what that means for you and your healthcare decisions. One of the reasons is that in some cases, there may be limited or no alternative treatments available that are as effective as the risky medications we've been talking about. So this can make it challenging for doctors to find safer options for their patients. And also, different patients respond differently to medications. A drug that causes severe side effects in one person might be well tolerated by another. So doctors often have to weigh the risks and benefits on a case-by-case basis. And again, sometimes, patients may insist on continuing a medication that they feel is helping them, even if there are known risks. Doctors must balance patient preferences with medical advice. So I've come to a conclusion that medicines, especially anticholinergics and antidepressants, are bad for brain health. And I'm really sure that you are very well convinced too, because I honestly tried my possible best on that. So as a cure to your dementia, I'll personally advise you to start intermittent fasting, and additionally here are some foods that will really help you along the way. Number 1. Fatty fish. Fatty fish are excellent sources of omega-3 fatty acids, including docosahexaenoic acid, DHA. Omega-3 fatty acids are essential for early brain development and brain cell communication. According to a 2021 article, DHA, in particular, may be vital for brain function and cell growth. Regularly consuming fatty fish may support brain function and reduce the risk of cognitive decline and dementia. Some examples of fatty fish include salmon, mackerel, sardines, and trout. These fish are not only rich in omega-3 fatty acids but also provide high-quality protein and other essential nutrients. Incorporating fatty fish into your diet at least twice a week can be a great way to boost brain health. Next up, let's talk about leafy greens. And that's number 2. Leafy greens contain antioxidants, vitamins, and minerals that may benefit brain health. For example, a 2023 study associates high homocysteine levels with an increased risk of cognitive impairment in people recovering from COVID-19. Leafy greens are rich in folate, a B vitamin that may help reduce homocysteine levels in the blood. The National Institute on Aging highlights leafy greens, linking them to fewer signs of Alzheimer's disease in the brain. Examples of leafy greens include spinach, kale, collard greens, and Swiss chard. These vegetables are also rich in vitamins A, C, and K, as well as fiber, which can support overall health. Adding a variety of leafy greens to your meals can provide a range of nutrients that benefit brain function. Knowing how certain medications might affect our thinking, especially as we get older, is important. But this information isn't meant to scare you. It's here to help you make smart choices about your health. By taking charge of your health decisions, you're looking out for your brain. It's never too late to start taking care of your thinking skills, and you don't have to do it alone. Remember, staying informed and involved in your healthcare is a big step towards keeping your mind sharp for years to come.